Conan Mustain. I'm a general and colorectal surgeon at UAMS. When patients say they've had rectal bleeding or blood in their bowel movements, that can mean a lot of different things. Patients may notice a small spot of blood on the toilet paper after they wipe. Some patients may notice a little bit of blood streaked in their stool. Other patients may bleed significantly and pass large clots and large amounts of blood all at one time. And those can all be signals of different things. Reasons that patients may have blood in their stool can cover the entire GI tract. Bleeding from an upper source, an ulcer in your stomach, a tumor in the small intestine, anything else can show up in your bowel movement if it transits through the GI tract. And then there are a number of things that can bleed within the lower GI tract. Tumors and polyps in the colon and rectum can bleed, hemorrhoids can bleed, fissures can bleed, and just irritation to the outside of the bottom can bleed. A number of these conditions are totally benign and easily treatable, but some of them are serious and require surgery to prevent cancer. So a lot of bleeding is just hemorrhoids, fissures, and minor irritation to the anus, but all bleeding should be reported to your doctor and worked up. A lot of times we do colonoscopies for patients that have classic symptoms of hemorrhoids just to make sure that there's not something else going on. I've had a number of patients who've been treated for months and months for hemorrhoids that had a cancer that was right within the reach of a finger on an exam. So, while a lot of times patients are nervous that their bleeding may signal something else, or sometimes patients are cavalier about their bleeding and think that it's clearly related to something that they understand, either way, it should be worked up in order to just have the assurance that there's nothing more serious going on. Patients really want to get back to a normal life. That's what's most important for most people. I see patients that come in all sorts of conditions. Some people are highly functioning and have had a routine screening colonoscopy that gave them a diagnosis they weren't expecting. Other patients have been severely debilitated by their disease for months or years before I see them. My goal for each of those patients is to get them to their highest functioning capacity. If they're feeling great and doing great, I want to keep them that way. If they're miserable and there's something I can help with, I'd like to get them back to doing the things that they were doing before they got in that condition.